All right, good afternoon, everyone. Today is an interesting day. It's a very sunny day in Canberra, and I've got the founder of Advanced Med and the career doctor, Dr. Anthony Llewellyn, the one and only guy who posts all the relevant videos for you on YouTube. So I've got some time with him. He's a busy man.
Hello,
So
everyone.
Thank you very much for giving me the time.
Oh, thank you. No, it's great to be here.
Excellent, and good to catch up with you.
Yep.
Now, Anthony, a lot of people have seen your videos,
Yep.
and they know your face on YouTube.
Yep.
But what's the story behind it? Tell us a bit about yourself.
Yeah, look, without boring everyone, I've had a fairly long journey to where I am now in terms of being a YouTuber at a fairly older age, I guess, working in the careers and doctors space. I think a lot of it comes from my passion for management in medicine and professional development, and those things kind of merge into things like getting doctors to think about their careers, not just now, but into the future, and how they can set themselves up for a successful career. I started out in medical school being one of those left brain people who wanted to do psychiatry, and I followed that through after my graduation, and I loved it, but I learned from that I kind of also enjoyed working with people, people management side of things. So that's how I got into management, administration, executive roles, and then a few years back I had a really cool job at a place called HEDI, which is an education group for doctors and other health professionals in New South Wales, and they kind of led me into the education space and thinking about how we could teach some of the things that just, in my opinion, aren't taught well in medical school or in other programs, like how to put a CV together and that sort of stuff, which kind of might sound basic if you're in a different profession, but believe you me, doctors sometimes struggle with that sort of thing.
Yeah, Anthony, that's a great career journey that you've spoken of. Let's go one step back. Like I'm really keen in exploring a little bit about how you decided to get into medicine in the first place, and then whereabouts did you grow up, and that sort of thing.
Yeah, well, I'm from Tasmania, which is an island at the bottom of Australia. I'm from a place called Hobart, which is the Aboriginal name is Munia, in those days in Tasmania, you kind of thought about living all your life in Tasmania, and I did fairly well in school, and I wasn't really sure what to do at university, but I liked people and I liked science, and Dad said, "Oh, why don't you be a doctor? It's challenging, and people can make a good career out of it." And I thought, yeah, well, why not? At that point, even going in though, I kind of had enjoyed things like psychology at school and stuff, so I kind of knew that maybe psychiatry was going to be where I headed. Which is probably a little bit rare for most doctors. There's kind of a different personality that goes into, or comes out of a medical school who then goes into psychiatry. There's some research about that. But that was kind of how I got into medical school. My medical school was kind of one of those traditional programs, and interestingly, as we were going through, they were redeveloping it in a kind of more modern context as we below us, but we never got to see the advantage of that. So it was very didactic, and I struggled with some of that stuff. I did struggle to be passionate about some of the things that weren't psychiatry in it. I got involved in some student politics while I was at university, and actually took a year off between finishing an internship where I was the president of the student union, which I to this day think was one of the best decisions I made, because it was a sidestep from medicine, but I learned a whole lot of organisational and people skills and processes and things that I would not have learnt from my medical school training, which I think set me up for the job of an intern.
Absolutely, no wonder you're a very good articulator of things, and I feel that that's a really good transition that has happened, and I think amalgamation of careers is always good. So
that's a good point. Like when I talk to IMG doctors, they sometimes are a bit shy about talking about the work experience they're doing outside of medicine, because a lot of IMG doctors like yourself, when they come to Australia, they can't get straight into doctoring, so they have to do something else, and that might be doing some research or teaching at a university or being a taxi driver or being a security guard. I always encourage them to put that down, because that shows that you've got other skills.
No, absolutely. I think that's a fair point. So some of the junior doctors may be interested in getting into a psychiatry career, although I know you've sort of moved on from that, but you have rich experience in getting onto the program. So how long is the program? How many years did it take you, and what does it involve?
Well, again, the program's changed a little bit since I did it. I am still involved in teaching psychiatry trainees as well as medical students in psychiatry. I think psychiatry is a really good career to get into if you're one of those people who are looking for a holistic approach to medicine. So if you're someone who likes and feels that it's important to get to know the whole person, their family, their context, and not just work on the biological side of matters in terms of offering them things that can improve their well-being, then that's a really good career for you. The one career we often see people often also heading towards, if they're thinking about psychiatry, is general practice, and there's a lot of parallels in the way you work with people between the two professions within medicine, if you like, or disciplines. So in terms of the nuts and bolts, after your first year, your internship, you can apply to get into psychiatry in Australia. You don't need permanent residency. So even if you're still on a visa, you can apply. I personally, and a lot of other people, do tend to suggest that you wait another year, because I think there's some benefit in getting a couple of general years before you go into psychiatry, because you can rapidly de-skill your medical skills. And it's important. There are a lot of medical problems for psychiatric patients that you need to be able to deal with. But after you get in, so there's a selection process, or I should say, it's basically a matter of filling in an application, submitting a CV. You need to have some written letters of reference. And then there's an interview, which is kind of structured around the competency domains that the college uses. The college directly uses the CANMEDS framework, so the interview is structured around your abilities as a medical expert, your abilities as a communicator, collaborator, thinking about what they look like in psychiatry. So, for example, you'd expect a question around how the multidisciplinary team might work in psychiatry. Like, for example, if someone disagrees with your diagnosis in the team, how would you deal with that sort of issue? In terms of getting into psychiatry training, because there are generally training spots available, it's relatively achievable, but you do have to show that you're got at the right status.
I must add that psychiatry, the College of Psychiatry, is one of the only colleges that does not have any fee for applying for the program. No,
that's true. Yeah, and I think that's a good thing. If you do get selected, there's a selection, like a startup fee that you have to pay, but that's only if they select you.
No upfront exams or anything along those lines.
No. So some of the other colleges are now making you do like situational judgment tests and things and paying for them. So most people do get in, but you do have to have the correct attitude. And then it's basically a 5-year program. It used to be kind of more neatly structured into 3 basic training years and 2 advanced training years, and it's kind of like that. But the exams have become a little bit more complex. There's a few more examinations. Usually you're doing about still 3 years of basic training. They're hoping you get through the main assessments by then, and then focusing on your advanced training in the last 2 years, I should say, which could be there's a number of options. You can just do general psychiatry, adult psychiatry, child and adolescent, hospital liaison, forensics. There's a few more.
Brilliant. Thank you very much for that bit of information on psychiatry. It's always good to know from somebody who has walked that path. On that note, what I'm going to do is put up a few links for the college underneath in the description. But then you had a bit of a twist in your career, so you went into medical admin and you did a degree, I assume, in that as well?
Yeah, so halfway through
How did that happen?
Yeah, well, halfway through, so I'm always a problem solver, I guess. And I like a challenge. So about halfway through my training, we had a real issue in my local training program in Newcastle. It's always been a really well rated program in terms of helping trainees get through their training. But we were really struggling because there weren't enough trainees. And so that was kind of creating things like roster fatigue and burnout, etc. And we actually got to a point where we were told by our union that we were going to be the first group that were actually going to go on strike because we didn't want to work. So there was an added thing to the roster, which was like the straw that was going to break the camel's back. But off the back of that, to their credit, the admin listened to us, and the solution actually was pretty simple. We just weren't focusing our efforts on recruiting other types of doctors, like international doctors. And just as a sideline, psychiatry it is one of those areas where IMGs on like the standard pathway or even specialist IMGs can often find a post in Australia because we're often looking for alternative workforce. So we just, if we were spending a bit more time recruiting some more people, that would help. And so I was offered a role. The business case was basically give me 6 months, half-time clinical, half-time admin, and I'll fill some of these gaps in the roster. And if I even employ one additional person, I've probably justified that effort. And so that's how I got started on becoming a medical administrator and learning about the executive side of running health, etc. And I went on, off the back of that, I worked collaboratively with the director of training to establish a bit of a harmony relationship around training and administration, and we won a few internal awards for what we were doing, and it just kind of went on from there. But what I learned from it is that you can work collaboratively, and sometimes the solutions are there. You just have to convince people that we just need to try something a little bit differently.
Yeah, talking about that, so some of the junior doctors may be interested in a medical admin role, and my understanding of the system is that you can actually do a fellowship in medical administration, and that's a specialist position. So
yeah.
Would you be able to shed some light on it?
Yeah, sure. So Australia and New Zealand are one of the few countries in the world where there's a recognised sort of specialty in its own right of medical administration. I'm not a fellow at that college. I have done one of the, you mentioned doing a degree. I've done a master's in health administration. It's now called a master's in health management, which is one of the degrees that is part of the component of doing that fellowship to join that college. But yes, it's called the college is called the Royal Australasian College of Medical Administrators, and it's the fellowship of RACMA. And again, it's like most fellowships in Australia. So this is a common misconception. Like pretty much every specialty in Australia, you don't enrol in a postgraduate degree in university to get to that fellowship. Sometimes you might do like a master's as part of it, but you actually have to apply to a college. So it's workplace-based learning at its core, and there's this college or guild that sort of supports your training and then supports you after as a member of that college. So again, it's a 5-year program, although there are some accelerated paths. You do have to do like a master's. There are exams. There are other sort of internal tasks, supervision. One of the things I think is good about the RACMA course is you get this thing called a preceptor who follows you all the way. Like an Uber supervisor, I think is the best way of describing it. They follow you all the way through your training. So you'll probably post a link, but you can find out more information on the RACMA website. And again, it's probably it is one of those specialty areas where they're looking for more members. So I've actually worked with a few IMGs who've sort of gone down that route actually. And if you go to any sort of conferences like the one we're at today, you'll notice quite a few RACMA fellows who are from overseas.
Yeah, and just to let everybody know, and I think Anthony, correct me if I'm wrong, for any membership or fellowship of a college, you're recognized as a specialist, and the pay rates are at par with each other, aren't they?
Yeah. If you're in the public sector, if you're a specialist, it basically goes on years of experience. There are a kind of few different ways they might pay you as like a staff specialist, which is a salary doctor, versus what's called a visiting medical officer, which is someone who's contracting, so that might be slightly different. But yeah, whether you're a surgeon or a physician, it's more based on your years of experience rather than your specialty, what you get paid. So there's not like individual negotiations around your craft. When you get into the private sector, it's quite different because often it's based on what you can bill through both Medicare and what else you can charge on top of that for patients. And unfortunately, like most countries in the world, the value of a procedure tends to be a bit more than the value of, say, sitting down and thinking and diagnosing and developing a plan. So generally, if you're in a procedural specialty, you'll do a little bit better. But as I've pointed out in a video that I made about what do consultant doctors make, most people do pretty well. In fact, in the top 10 professions, according to the Australian government, in terms of earners, annual salary earners, we've got 5 doctor professions, including psychiatrists. So psychiatrists do pretty well in Australia.
And the best trade-off is that you're not doing any night shifts or probably not even many weekend shifts.
Well, if you're working, that's not absolutely true. So even if you're working in the private sector, you might be, say, a lot of private specialists will have admitting rights to private hospitals, so they might be on call for that. It's generally not as busy as, say, the public sector. And then if you're working in the public sector, that will vary depending on what specialty you do and where you are. So, for example, in my specialty of psychiatry, I'm on quite a big roster in terms of the number of consultants. So that reduces the number of times you're on at night. But when you are on night, you get hammered. So you're getting called pretty much the whole night and you don't get a lot of sleep. But, at least again, one of the benefits of being a consultant, you can usually work out how to have a day off the next day. That's, you know, generally able to be done. There are some specialties where you're expected to be even in the hospital at night. Things like intensive care is probably one of them, or surgery. Sometimes you have to come in, anaesthetics, emergency medicine. You know, they tend to work a lot of at least evening shifts as a consultant. And then if you're like in a regional or rural place as a consultant, you might be on a 1 in 3 roster. And if you're in a busy specialty like, say, general medicine, that can be quite taxing. So that does vary. And generally, in most cases, you just get paid an allowance for whatever on-call you do. Like, not for it, you get paid an annual allowance for doing on-call, and it doesn't tend to matter as to how much time you're on call. So that can be seem a little unfair at times.
Yeah, no, fair call.
Yeah.
Anthony, I really appreciate your time. I have to appreciate the fact that you've put in a lot of content for both local doctors and international doctors, and they're very appreciative of that. And I congratulate you for all your efforts, and keep continuing the good work. Thanks very much.
Naj.
Cheers.
Bye, everyone.
Bye.
Good.
All right.
Sound okay?
Yeah.
I might just pause
that
it.
went a bit longer than I thought, but that was good. Really good.